So in this session, the presenter is going to be Dr. Ivan, the Senior Medical Officer at the Community Health Department. The parish development model is a model that is being implemented and very important, both at political level and social level. The President of Uganda is now traversing the northern Uganda, trying to sensitize the people about this particular model. So Dr. Ivan, I hope the IT team has already loaded your presentation. So Dr. Ivan, come to the podium. Meanwhile, as she is coming to the podium, tomorrow we are expecting the Honorable Minister of Health. And we should be ready for her because, remember, both the principals went to the President, so they must be having the same message. So everyone has a style of presenting what they passed through, so we have seen the first time. Yes, we are moving to action, but it is all very well. We are just being engaged to have another year, and she went back very happy. Okay, so Dr. Ivan, come on. You are presenting from here.
Good afternoon, everyone. Yes, my name is John Carter. I'm a senior medical officer in the Department of Community Health, and I have been, I was assigned to support on actualizing the integration of health into the parish development model. By a show of hands, how many of us were in Kalanga last year? Quick show of hands. Quick show of hands. Those that were not? Some people don't know, I think. So those who don't know where they were.
What about the boys?
Okay. So why I ask that, it's not the first time that we are trying to understand how health fits into the parish development model. So last year, most of the discussions during the retreat was centered around the parish development model and how we as players in the health sector are supposed to fit in or contribute to its aspirations. So this time, following the resolutions that we made, I think during Brenda's presentation, we must have noted one of the things was, or one of the resolutions was to operationalize the social service pillar of the parish development model. So this presentation is going to focus on, because of the extra hands that were up when we say some of us were not in Kalanga, we are going to highlight the background to the parish development model, what exactly we envision to be, or what we envision as health, or what our role will be as players in the health sector to see that we support the delivery of social services and then we shall look at what progress we have made in trying to see that this pillar becomes functional, and also highlight some of the gaps and challenges that have probably been noted along the way, and conclude with some of the next steps that we think are critical to address some of the high impact intentions that were addressed in the previous session. So this is basically the outline, which I've already alluded to, the background to the parish development model, what progress we've made, what opportunities we have and which gaps are there, and then how we can fast track the implementation. So when we look at our third national health policy, its draft, it's in line with the National Development Plan 3 and as well as the Vision 2040. And the focus of those documents within our policy objectives 3 and 4, we are taking services back to the community level. We are trying to emphasize decentralization of service delivery, and this is through a community health platform for service delivery. And this has also been elaborated within our national community health strategy. I believe that was highlighted as well by Brenda in her presentation. And our focus, when you look at the strategy on Direction 7, which looks at engaging and empowering communities for better accountability and improved health outcomes. That is where the parish development model comes in strongly. So the PS in her submission earlier today said that PDM is not about money, and rightly so. The parish development model runs on 7 pillars. However, when you go out and you do a quick survey, anywhere you go, you find that most people associate it with only pillar number 3, which is the financial inclusion. But this is, yes, it's a development strategy that is trying to see that we have better local governance for socio-economic transformation. But this socio-economic transformation requires a whole of government approach. That's why it's not just a matter of Ministry of Finance or availing money and financial resources to people. So the 7 pillars are as highlighted there, but our focus today is going to be on the social service pillar, which is pillar 4. And this is critical for healthy homes and healthy parishes. So the social service pillar has a vision, and what we aspire to have is a healthy, enlightened, skilled and productive Ugandan population with the mission of promoting citizen-centered access and utilization of quality social services for all Ugandans at the community level. And how are we going to do this? 1, we intend to have a framework of leadership and coordination for all matters related to social services, that is at the parish and the village level. 2, we want to have effective mechanisms through which resources that are available at the parish or village level can be effectively leveraged. 3, we want to have increased community capacity in the ownership and sustenance of social services. And lastly, we want to strengthen all structures at the community level so that they can support improved delivery of social services. So I would like to draw your attention away from your phones, away from your books, away from your laptops, to the slide right now on display, because this is the essence of what we should be doing under this pillar. So if we do all these things that are highlighted in that schematic, we think that we shall be able to create health through the parish development model. And with that, we shall have our leaders, first of all, more supportive towards health interventions. Right now, I think in some communities you find the local leaders and that last mile are not entirely devoted to supporting health intervention. Two, we shall have better or increased use of data at the community level. And this is to support planning and accountability. We shall have increased intersectorality within our interventions, right at that level. And lastly, we'll have increased ownership, utilization, and access to these social services, which are health, education, safe water for all individuals. So, when you look at that part that says implementation, we'll start from step one, the individual within a household. Are we together? Are we together? Yes. So the individual at the household, we want them to be responsible for accessing and utilizing, as well as maintaining social services on a daily basis. So it's not just a matter of demanding for services or complaining that the services are not available, but we want them to be part of the process and part of that service, and that they are also responsible to see that whatever resources are in the community are properly maintained. These individuals are supposed to feed into the village, and this is where we intend to have village health committees in all villages across the country. We might not have a chance to highlight the composition of these committees, but quickly, if you know the local council executive committee at that village level, where you have the chairperson leading with a secretary for women's affairs, a representative for the youth, representative for persons living with disabilities, the older persons, and religious and opinion leaders. To these committees, we want to go up to the VHTs to support on the technical aspects of health. And here, we want the villages, first of all, to be engaging in quarterly meetings. And in these meetings, they need to, first of all, review the status of their communities in terms of some of the indicators that we are already capturing at the community level. So the electronic community health information system, wherever it has been deployed, will be very important in this step. So in these review meetings, the communities will identify the challenges that are really significant to them, come up with action plans to which all members within the village will be accountable to see that it's implemented to the last mile. And these action plans will be implemented and reviewed regularly by these committees. The committee will spearhead this process, but we envision that the entire village will be part and parcel of this process. So the villages will feed into the parish. That is where you're seeing step 3. And at the parish level, the villages will be part of the election of representatives to parish committees, or the Pillar 4 committees. These are the ones responsible for the delivery of social services, and this is what the PS was trying to emphasize earlier on today. So these Pillar 4 committees will be supporting the villages in the regular planning exercises and reviews, but also we envision that they will be supporting the implementation of action days on a quarterly basis within the different villages in their parish. They will consolidate the various village action plans into what we call parish action plans, and they will also support reporting on social services, but also support linkages to the higher levels. So where the village has an action plan and one or two of the actions require the support or the support of the parish or even the district, they will be working through their parish committees, the social service committees, to to lobby for this kind of support. When you go to step 5, the PDCs, these will be, of course, they're already established in most of our communities, and they will do quarterly meetings. They will support the Pillar 4 committees on matters related to health, water and environment. They will monitor service delivery and also design and implement the parish action plans. Lastly would be the parish councils, which will be meeting quarterly and select members of the P4Cs and also enforce some of the resolutions that feed into, that come from whatever has been prioritized at the village level. I believe in the presentation on the facility catchment area planning and approach, we must have noted an area of prioritization during one of the steps in that approach. And some of the things that inform the priorities of the facilities will be coming from these parish action plans. So that's where we are trying to see that there is, first of all, bottom-to-top planning, but also the interventions that we provide funding for through whatever funds have been availed in our facilities are responsive to the needs of the community. So, what have we done since the last declaration? So, at the time of the last declaration, we had a draft Pillar 4 implementation manual. So we know that the PDM was launched in 2022, so between then and January of this year, we've been trying to engage the various stakeholders at all levels to see that these ideas speak to each and every one that will have a role to play. So I'm glad to inform you that this manual was finally approved by the first lady of the country, the Minister for Education and Sports. And whereas we might not have a chance to launch it, but we are going to be able to access this document at the end of this presentation. So between February and May 2026, so we are in that process. We want to see that we consolidate whatever little action has taken place. So we've done some work in different parts of the country on the implementation of this approach. And from the various lessons that we are gaining, from the various feedback that we get on what gaps maybe have been noted, we intend to consolidate all this input and fast track the implementation such that by June 2026, we shall be having social service delivery under the parish development model in all parishes in the country. And beyond that, we shall simply be doing our monitoring and evaluation to see that what we have established continues to yield results as intended. So this just highlights the Pillar 4 implementation manual. That's the front and the signature. And those are the partners that were actually part of the process of developing this manual. So we are very thankful and grateful for the continued support from UNICEF, BRAC, the World Health Organization, and Living Goods in these works. As well as for that particular exercise, we had lots of support from the from the Backup Health Project and the GIZ through UK. So these are some of the things that we've managed to do. Engagements with district leaders in the Akole region, as well as Bunyoro sub-region, and these mainly came through the support of the World Bank. So, what are the opportunities and gaps that we might have going forward? Because this is something that we want to see happening in all our districts, in all our parishes across the country. So one is that whereas we have spoken so much about the parish development model, very little has been understood about how the other players are supposed to fit into this approach. So the capacity for implementation at the various levels has been limited, but we believe that with some of the next steps that we are suggesting, we shall be able to address some of these gaps. Secondly, the multi-sectoral collaboration is still something that we are trying to fully concretize as ministries, agencies, and as a country. And because of the suboptimal, multi-sectorality in planning and action, some challenges might arise, but we shall prescribe some solutions, and we believe that collectively we'll be able to get to that goal. The other is around funding for implementation. I think that is always something that comes up, but we are so many in this house today, and we are so many players in the community health space, so I believe that if we put our hands together, we shall be able to achieve. Lastly is around the collection and use of quality community health data, so that we have evidence-based interventions under the parish development model. If you are keen, during the presentation of Brenda's presentation around some of the progress we've made, the electronic community health information system, which enables us to have real-time community health data, is only in 21 districts. So the gaps around our traditional methods of reporting are still there. And even with the electronic community health information system, if you speak to the experts, they will tell you that even within, there are some challenges that we need to address. But collectively, we shall be able to deliver. So, the opportunities. One, this is not Dr. Chiwanoka's agenda. This is not Basenge's agenda, nor is it something that the PS is pushing as an individual. This is something that comes right from the highest office of this country, the office of the President. So with that support from the executive to see that this intervention succeeds, but also some of our other sectors and other ministries and agencies like the office of the Prime Minister, we believe that we shall be able to succeed if we can leverage that support effectively. Two, we have a secretariat that has been dedicated to coordinating the parish development model under the Ministry of Local Government. And currently they are trying to harmonize the M&D framework so that ministries, departments and agencies can work and fit better and into this model, and we see better accountability by the various players. We have ongoing programs like the Choose in the ministry, the revitalization of the VHTs through the Health Promotion Department. We have departments within the ministry that are working at the community level, but also other ministries. And the electronic community health information system is also another opportunity that, if we can leverage, will get us there. The NDP4 framework, which is almost at final stages, has already captured indicators focusing on the parish social service committees and how they are delivering interventions for health. And we believe with that capture, we might be able to attract some funding, but also improve our reporting approaches. The partners, we are so many, and we have been very supportive so far in this journey. So going forward, I believe that working together, we shall be able to see that this model works out. Lastly, we have guidelines and standards in place. The integrated the National Community Health Strategy Implementation Guidelines, and then this Pillar 4 Implementation Manual. I think they will be critical in guiding us to do these efforts, or to deliver these efforts in a standardized way. So, what do we think we need to do to consolidate and fast track implementation there are so many things that we put together. Under each of these, the four that you're seeing projected, there are various actions that we have to, or various small activities that we have to undertake to see that we get to that point where we have consolidated and we are on track to achieving the various goals. So under coordination, we need to strengthen coordination of partners, the ministries and departments, as well as agencies, but also the civil society organizations, so that we can collectively implement Pillar 4 interventions. Secondly, we talk about funding, but an analysis will show you that there is a lot of resources in the community, only that they've not been properly harnessed. So we believe that if, as partners, departments and ministries, if we start to integrate Pillar 4 implementation into all our plans and intentions, the funding will not be a problem. Second last is the capacity, and this can only be built through operationalizing the Pillar 4 implementation manual. And lastly, data use. We need to strengthen collection and use of quality community health data, so that all our interventions under this approach are evidence-based. So if we do all that, we'll have better performance as actors in the community health space, but our communities will also have better access to services and of good quality. The communities will be able to own and sustain services at whichever level, be it a village, household or parish. And lastly, the linkages and coordination of all stakeholders will be enhanced so that social services are better delivered. At the end of the day, we shall have a healthy, enlightened, skilled and productive Ugandan population, which is the inspiration and the vision 2040. So thank you so much. That was all I had to present. If you wish to access the manual, you can scan that code and you'll be able to access the soft copy. Thank you.
Thank you very much. Now that we are not going to print the manuals, you scan and put it on the phone. UNICEF. We are not going to request for printing manuals. So we scan before it goes off. Yes, that is how we shall be moving. Yes, whatever was decided is fast-tracked and we are implementing. No printing manuals. So that was the status and roadmap of PDM Pillar 4 implementation, scale up of the social services pillar. So he talked about fast-track activation and operationalization of the parish social services committees. Now we are entering into a discussion. Over break, I was guided and advised that I am not allowing people to dialogue. That when they put up their hands, I'm not giving them space. So I'm opening up the space. How many microphones do we have? The space is now open. Questions? I want my ushers. Even comments. The space is open. It was closed, now it's open. So, which commissioner has the hand here? I would prefer the presenter sits in the middle.
Two very brief comments.
Yes.
One is appreciation of the presenter. Thank you so much. Number two, I just disclose to the general audience. EM was, as we got a preamble from OPM, a tool for this campaign period, manifesto period 2021-26. Are there some districts that are able to share some experiences on how they've been able to use this, because he clearly showed us where they are now. Then two, I just needed some more clarity on the parish council. My elite experience, from people who are really grounded with district work, my elite experience, if this is a non-functional local government, does it have a council? Is it a sit-down? Like yes and no, that's what they thought also. The parish council, like the word parish council, I don't know what that one looks like. Because I know there is a local LOC2, but LOC2 having a council or a decision-making body around there, I'm not so sure who calls it, who convenes it, and that's very critical if we are to understand the whole parish concept well.
The parish council, you're not
parish
sure.
Council. Clarity on that.
Who
are the members of this parish council?
Yeah, there are some people who are in the district local government. So you will tell us, these parish councils, even me when I go there, we don't interact much with these councils apart from the parish chief, right? Yes, when we are distributing mosquito nets, you go to the parish chief and it's only one. Yeah, I'm with you. Yes, we are discussing. Yes, there's a hand there. I'm the chair for the session. I'm the same time the MC, right?
Thank you so much, Chair, and thank you, Dr. Ivan, for the presentation. Just to share a few ideas. One, as a buffer, education and work for both. There are opportunities for enhancing PDM under the Pillar 4, looking at education and health in institutions, in schools, both university and the lower tertiary. I have been doing this under patriotism. Now the Office of the President, Patriotism Department has funds to provide patriotism trainings. In some situations, they sponsor everything. In some situations, the school bring the resources. Like our tertiary institutions provide the resources for that. Can we, when they are doing their programming, or reach out to the Commission on Patriotism to see how can integrate people in the Zim activities? I think this will be very good. Secondly, under the Ministry of Education, Health Department, we can take lead in helping enhance or accelerate the interventions under PDM through the health training institutions, because they have a docket of community health and PXC, of which they also have school programs. That if we give them empowerment through the Ministry of Education, we shall be able to cover around bigger space. And trust me, coming forth annual community health partners retreat, education will be faring very well under community health. Thank you.
Very good. You are talking about patriotism under the Office of the President. Yeah. So when they make their work plans, we try to reach out to them.
The good thing, you just walk in and you make a plan there and then for the next quarter. So if the quarter based planning,
you also we just walk in. Yeah. Very good.
I've walked in and I know what's happening there.
Okay. So I hope Rapporteur, you are taking this thing because we are going to take action. We shall walk in the Office of the President. We tell them we want this to be done. Very good. Then, Mohan, there's a hand this side. Take those points, we are taking action. With this one, we need a microphone this side. This one. It's very difficult to be a chair at the same time as MC.
Thank you so much, Chair. MC at the same time. I want to respond to what the Commission on Productive Health just talked about in regard to the parish councils. The parish councils are there, but dormant. So, yeah, if we are to operationalize the PDM Pillar 4, we must have among the activities to do to reactivate these councils. Otherwise, they are there, but dormant. You only see them when they are coming to solve land disputes, and that's where they end.
So the parish councils are there but dormant?
Yes.
Who makes them dormant?
council is a bigger body. And by definition, it's a seat of villages are
So it is composed of which people? The representatives from villages, the LC ones, the chairpersons.
There are councillors there.
Madam, can you come at the podium and present this?
Councillor from a village.
The people want to know.
There are no councillors.
Can you give him
It's
a...
confusion. Now this is confusion.
Yes.
Councillors from a village.
Okay. Yes, please. Okay, there's someone who is going to come and explain. The councils are there at Doma.
There's someone from the village.
Okay, as he comes, I'll give you what I know because I've dealt with these people for a long time. The villages elect village councils. When they finish electing, they sit and elect their representatives to the parish.
Yes.
Then those representatives from the various villages meet at the parish and have been elected to form the parish council and elect their chairperson plus other leaders. Thank you.
That is it.
Okay, thank you very much. So there's someone from the district local government.
That is it.
Yeah, can we finish someone from the district local government? Then in our awareness will come. Rapporteur, make sure you write these things.
Thank you so much. My name is Francis Apokiti. I'm the district chairman of the new district local government.
Oh, very good. Yes, I did the president.
For them, they use the composition.
What can be
Because the very chief is
This is what happens. I think the one council is one which is confusing.
Thank you.
In the NC2, which is now in this parish, we have a political organ which is called committee. It's called it's a LOC2 committee chaired by the chairperson. And that committee is composed of, again, the secretary of the environment, youth, and it's a committee. So the word council is one which is confusing. But those members that form like LOC1 council, so not LOC. You see, when you say local council committee, so the other one is called local council committee of the parish, and it sits now. The challenge has been the challenges affecting local councils, both from the district, some counties that are synonymous with all councils, which is about financing, operationalization. That render it dormant. Now, in addition to that, I think I can also now make a submission on this matter. I think it's important. I'm happy, first of all, for the first time, that we are now beginning to fast track the other pillars of PDM. Because out there in the villages, PDM is known as the program of 1 million. So once people get the 1 million, they have got the PDM. So we have to fast track this pillar because we don't want this PDM also to suffer like what happened to Plan for Modernization of Agriculture. Because there were other pillars that never got financing, and we only now government has been telling us in local government the discussion has been that there are other programs like UPE, and in this case now health. As politicians, we met and discussed this matter on integrating health in PDM. And the challenge was, maybe now that it's getting clear, there's going to be community health. Because there is a policy prescription given by Minister of Health that apart from the existing health center tools, there will be no more creation, or in this case construction of health center tools at what? At parish level, as government concentrates on upgrading and equipping health center trees upwards. So the politicians were asking, so what happens to the parishes without what? Health center tools. Now that the language is getting clear that to those parishes that don't have health center tools, they will concentrate not on the curative. They will deal with prevention and disease control as community health package. But it will be very, very important that the other pillars, as the health is doing this, even education should be doing this. Just like the way the 1 billion, the famous 1 billion given to districts for roads, they form part of the package of PDM, because some of those roads now extend
not just to district roads, but also to community access roads. So programming the holistic way to make sure PDM, because even right now the president is in Kaberbaitu, he's visiting farmers, and the language that you see in the media saying is that the president is monitoring PDM. So in the mindset, they're thinking now your PDM is what the president is on. Is monitoring the 1 million. So what we say means a lot to the ordinary citizens. So the earlier we fast track this integration, the better to save the PDM as we know it.
Yeah, Minister of Health is fast tracking.
Yes, the non-functionality of the council,
yes,
that political structure, is it an issue in implementation?
Now, even in the current state, how is the current PDM, the one which has moved faster? Because there is 250,000, which is given per quarter for parish numerous committee members to approve the 1 million, the financial pillar. So it's just, maybe we can just say, we can add, because that committee now already has existing one, financing of 250,000 on a quarterly basis to facilitate it, and it's broken in form of stationery and other lunch, transport, stationery for the parish chief. So it convenes. So we can now take advantage of the existence of that and expand the menu of what it can do to include what?
But you know very well that the financial inclusion pillar had to move faster because it is earlier mentioned, right? So, we are about to...
Thank you very much, Chairperson, and thank you, Dr. Ivan, for your presentation. My question is around the role of non-governmental organizations in the implementation of PDM and the activation of the committees, the councils. So I really want to understand that clearly, and also how does the community development officer comes in this model? How do we engage the community development office in the implementation of this model?
How do we engage the CDO? So let's have the last question and Ivan response before he forgets the question, right? We agree because the space is open. So let's have one question. Yes. Then I will come back to you. So this is the last question, then I'll call Ivan to respond.
I may not be asking questions but providing answers. I work with local government DHO Marachas. I don't know whether OPM is in the house.
Is OPM in the house or on recess? Yes. On recess. How shall we get over it? I'm going to draft the letter.
Otherwise, PDM was meant to deepen decentralization and take services closer to parish level beyond sub-county and town councils. But what we have seen is totally different, just like our Honorable Chair has said. Those 7 pillars, how I wish we started with the mindset change as pillar number 1, and we moved in that direction. And the social services came thin along the way. Actually, as a district health officer, I was not invited for any single of those meetings, but I ended up understanding because I know PDM development cannot go without health. Just as other people have said, a parish development committee as the LC2 chairperson, as the political leader. It has the parish chief as the technical coordinator. That's why the government had to ensure that all parishes and the wards for urban local governments had what? Parish chiefs or town agents. Then the LC ones in the area will combine to form part of the committee. Where a school exists, a church or a place of worship exists, the leaders there become part of the committee. And that's how they are constituted. The chairman has already told you how they are facilitated under the 1 million arrangement. Now, what we need to do differently is, that's why I was looking for OPM. we needed an all-inclusive group of indicators for managing or for monitoring all the pillars. From production and productivity, what are the key indicators that we want to use? From infrastructure, what do we want to monitor? And so on until we have the seventh pillar. Once we don't have all those overarching ones together, monitored under the same house or under the same roof, we shall go in a mess and see this money is lost, just like other livelihood interventions. Moderator, I also said, Chair, I also said in other meetings that everybody lives in the parish. The disabled live there, the youth live there, women live there, and so on. Why should we continue to have multiplicity of livelihood interventions? Or where is it youth livelihood and mediocre? Why don't we collapse them and put them under PDM? That is what nobody has listened to. And we are wasting resources. I submit.
Thank you very much for that submission. So we call upon Dr. Ivan to respond.
Thank you, moderator and chair. So, yes, thank you all for those comments, and most of it was feedback. For districts to share experiences, I believe some experiences have been shared. Clarity on the parish council have been noted. The opportunities to enhance education institutions, this is also noted. We shall work through the chair and the chair and director of programs for this retreat. He's the one who is most capable of walking into any office and getting immediate feedback. And collectively we shall see how best to work with that institution. Ministry of Education is part of the social service pillar. So whereas this has mainly leaned on health, if you look at the composition of the parish council, if you look at the composition of the village health committee, these interventions are supposed to speak to each other at the parish level and right up to the national level with all three line ministries and all players within those line ministries working together. But we shall definitely explore those opportunities for better collaboration with Ministry of Education. The challenges with the LC2 committees is mainly, I think, around funding as well. And that is where we are going to have more deliberation to see how best to strategize and navigate those waters. Integrating health into the PDM, this is what we are now undertaking, and how to leverage the financing into the Parish Development Council. This has also been noted. The CDOs, so the PDM has 7 pillars. One of these is mindset change, and it's already in action, although, like we said earlier on, they did not move ahead, like the DHO Maracha has stated, but they are now on ground and they are working. So the thinking was that these committees will work to focus on water, environment, education, as well as health matters, but the linkages will definitely happen, so that the CDOs get to contribute to some of these deliberations within the pillar committees at the parish level and support any matters related to social security and empowerment at that level. Lastly, the collective M&E framework. So this program is being evaluated at the highest level. So last year, an audit exercise was conducted by the Office of the President through, I think, the Directorate of Governance to identify some of the challenges that are impeding the achievement achievement of results that are envisioned under the parish development model. And one of those identified was the M&E framework. So the Secretariat right now is already working with that collective M&E framework. Consultations happened last week, where all the functionaries were called together to contribute towards an M&E framework that speaks to them rather than have something prescribed by the Secretariat. So with this harmonized framework, we will definitely have better accountability by all ministries, by all districts, and players at the parish and village level to in their efforts towards actualizing the intentions of the parish development model. I believe those were all the comments and questions raised. Yes.
Okay. Good afternoon, colleagues. Yeah, by the name is Wonderful Faisal. I'm an RETREAT technical advisor with the Ghana Muslim Medical Bureau. But 2 months ago, I was just handpicked by the Bureau, but I've been in the local government. I just wanted to share something small about what's happening. I know really what's happening here or what's going on is that we are speaking a lot of English. As the PS said, I don't want to maybe I gave a call on something I think she was preempting what I really had. And yesterday I discussed with Dr. Sarah Biakika. I went and met her. But I was saying that yes, in the minimum care package you have, why don't we include the social economic impact? Members, I told you I was working with the Nakasek local government and the Nakasek hospital in particular. The issues of poverty are very alarming. And when the custodian of health, the definition of health has the issue to do with complete, a state of complete. But the minimum care package we have is not complete. And really we are almost fighting a wrong battle. Why don't we also go on and then catch up with this? And I think that's why the president is not happy with us as Minister of Health or as the service programs. We're really letting him know this parish development model, alongside all these other issues, the Malta Declaration, the MDGs, the Millennium Development Goal, the SDGs, the NDP3, they're just simply telling us to align. Now, let me go to this example. Nakaseke, when I realized that we are really not doing much to our patients, when I went to our dashboard, the data center in the hospital, I realized there were some aligning gaps. There was a discrepancy in data in HIV on ever enrolled on ART and then the people were active. 608 to 1,759. I said, where are all the 4,000 persons? So when I went there, I did go cross-check with the expert clients, with the people there, and they told me, no, poverty, other people are falling out of the program, people are doing this, can't continue on add this and the other. So at the end of the day, I said, now, let me go back on the ground. I wrote a concept, and I said I should start supporting our people. And I came up with a project on improving socio-economic conditions and food security of persons and families living with chronic disease condition.
Excuse me?
Sorry? Yes.
We want to see the linkage of your question or comment.
Yeah, so what I was saying, that why don't we bring PDM into the hospital, the service setting, we can open up the window. Let's open up the window because why? We know these people, we know these patients, we have their biodata, we know the money is being given to the LOCs, and the LOCs are calling all their relatives and other people. But for us, we don't have these people. We have these patients, we know everything about this part, we can serve them much better. I know the fears having money or handling the money, let them bring their people there within the health facilities. What is easier for us to have a linkage and just have a pass. Thank you.
Yeah, here's a good point, but it was quite big. It's trying to say if there are issues,
It's trying to say that if there are issues at the facility, how can they be captured at the PDC, Parish Development Committee? Let's agree we leave out that. So
that is what he's trying to say. Who represent these issues at that PDC? And that is what Chairman said. Is it possible to expand this PDC and we have an health-oriented person, maybe the health assistant? Is the health assistant part of the PDC?
Yes.
Very good. The question is answered. And your issues as a facilitator, give the issues of the numbers, people lost to follow up to the health assistant who sits on the PDC every quarter, and all your issues will be covered. Women who have gotten lost, children lost to care, that is where the health issues will come in and they will be heard and listened to at the PDC. I think that's the real point that they are. Thank you so much.
And through the facility catchment area approach. HIV or poverty related, this feedback can be given to the functionaries at the parish level, and community evolved solutions can be generated and implemented. We have 2 months, Chair. Am I the chair now?
Okay, thank you so much, Dr. Ivan. Mine is actually not a question, it's a suggestion. If maybe you can put back the slide for gaps, but I captured them. Ivan clearly stated about four gaps in this implementation of PDM. Maybe first of all, we should all get converted and forget to think about that PDM is money. If we think in that direction, we are not get anywhere. In the first gap that Ivan presented, he talked of limited capacity of implementing at all levels. And this goes back to my brother from the Muslim Medical Bureau and from the Catholic Medical Bureau. Okay. So can we make sure that all levels, because my we can suggest that from now we go in groups and get these gaps and get remedies. If we put down our brains and say, group 1, what can we do about the limited capacity of implementation at all levels? Group 2, he mentioned the suboptimal of multi-sectoral planning. How many sectors are here? Because we have different inputs, because we work from different areas. So can we get maybe a group like that? I'm not...
Yes, we have to,
but I'm suggesting.
Yes.
Then he talked, the last one, capacity of data collection. That goes back to the data you are referring to of Nakaseke Referral Hospital. I know you, CMB, supports the Catholic facilities in your world. If we don't have competent people to collect data, you will always get the wrong data. So what can we do? How can we sit down and maybe brainstorm and say, how do we get a remedy for each action for this gap? Then from there we shall be on the tracker for fast tracking.
That's very good contributions, Madam. I feel the rapporteurs have taken most of the questions and the answered questions. Today we have a very... You want something? Okay, I was receiving some guidance. It was because I'm seeing the time. I don't want to keep. We have a tight program tonight, and people were disciplined in the morning, so the energy level was there. So we need to activate it. Self-care, isn't it? Self-care. So we need to activate their morale as they are getting energy for the next action. So I am going to say, so that we get more. So today we have a live band, and dinner at the pool. Probably maybe there we can discuss how we shall do. Remember, this is a retreat. When we start out with group work, we shall leave at 8 o'clock like yesterday. Yes. So, let me first give you what we're going to do tomorrow. In the morning. I know Commissioner is still on phone, but this is going to be his chair. All regional referral hospitals with catchment area districts, civil society and partners agree on how to deepen community health service delivery. Analysis of regional performance, regional support to districts they have at stock, set annual targets, agree on coordination, and the chair will be Dr. Richard Mugai. So we are beginning the project at 8:30 a.m. But the dinner here for today is for everyone. The live band is for everyone to see. The drinks are for everyone to drink. And then there we shall discuss how we shall make groups. So that we can activate ourselves for the session. Thank you very much. And now, I was about to close.
No. You're not going to get people here at 8. They will not come here. They will not come here in the morning at 8. I know them. They will not come.
Okay. So we make group work, eh? Yes. So we make the groups or we make
Good afternoon, colleagues. Is it good evening? What's the time?
You see?
4. And we had also a complaint that there wasn't enough time for networking. The dinner venue is not closed off to us from now, so we can go and start networking. Commissioner Mugahi, the past days we've been leaving here at 7:30. People are tired, they have brain fatigue, so we need to go and check our bones and relax as we strategize on how we are going to ensure we improve the health of our people's rights in their community settings. So at this point, I'll call a volunteer to give us a closing prayer. Everyone, before you go out, you have to pray. Okay, I've been told to pray, so let's pray. Father, thank you for today. Thank you for the good lessons we've learned. And we thank you for the evening dinner we are going to have. May it be very resourceful and that we shall be able to network and make meaningful connections at the end of the day. In Jesus' name I've prayed. So enjoy your evening, please. The dinner is for everyone. Don't leave the food and the drinks for us. Even if you go back to your room, please endeavor to come back. This will be the time for you to network. If you've been seeing someone you've been wanting to say hello to,